Dear doctors, neuroanatomy is that one topic where there is always one or two questions asked. As each and every mark is very important for us, let's focus and try to get that one mark from the neuroanatomy. Let's go. You're going to sit back and listen to the topics nicely. We'll be discussing about the circle of Willis, yes, central nervous system, cranial, motor versus sensory. We'll talk about the brain and the spinal cord. We'll discuss about the ventricles of the brain, the meninges and the myelinations. Let's dive into the lectures. Talking about circle of Willis, we are going to draw an image, and I hope if you can possibly take a paper and a pen, draw along with me please, so that it will be very easy for you to remember. Now draw a V which will represent the vertebral artery, yes, and then you are going to draw a line like this which is going to represent what? The basilar artery, and then simplifying you're going to draw the posterior cerebral artery, and then this line just above this will represent the posterior communicating artery, and then we have the internal carotid artery. Two lines is going to be the middle cerebral artery, and then along with this we will be having the anterior cerebral artery. We will discuss this again, don't worry, and then we'll have anterior communicating artery. So this circle, if you can try to practice, it will be very easy to remember all the important arteries of this circle of Willis. Let's focus on this image and try to learn a little bit more. So these are the important arteries. Let's try to revise them again. So the V-shaped one, this is going to be the vertebral artery. This is called as vertebral artery, yes. And the base, this is going to be called as what? The basilar artery. This is called as basilar artery. Just above this one is going to be the posterior cerebral artery. This is called as posterior cerebral artery, and this is going to be posterior communicating artery, posterior communicating artery. Here we have the middle cerebral artery, middle cerebral, and then we have the internal carotid artery. Along with that we have the anterior cerebral artery, which is going just above like this, anterior cerebral artery. Let me just write it out again, anterior cerebral artery, and this is going to be the anterior communicating artery. Yes, so these are the important artery which is just represented via these diagrams. Yes, if you can remember this much, it is going to be more than enough. For extra edge, you'll have to also probably, it's good to remember a few more arteries which are going to be these ones. These ones are going to be the pontine artery. These are called as pontine artery. Yes, and this one right over here is going to be posterior inferior cerebral artery, cerebellar artery, and this one which you see here, this is going to be superior cerebellar artery. Remember, this is going to be superior cerebellar artery. Yes, so if you can remember this much in the circle of Willis, or at least this one, will be definitely getting that one good mark. Circle of Willis is going to be very important topic for our exam and for our knowledge as well. Now we are coming to the neuroanatomy. We are going to study about the central nervous system and the peripheral nervous system. The word itself says central. It's going to include the brain and the spinal cord. Yes, central nervous system includes the brain and the spinal cord. Very good. What are we going to study in depth about the brain? We'll focus on the cerebrum, cerebellum and the brainstem. And this region right is going to be the spinal cord. The peripheral nervous system, in short called as PNS, it has the cranial nerves and the spinal nerves. These are going to be the cranial nerves, and here we have the spinal nerves. Remember, we have 12 pairs of cranial nerves and 31 pairs of the spinal nerves. 31 pairs of spinal and 12 pairs of cranial nerves. The brain which you are seeing here, this is also called as encephalon. Yes, you heard it right. It is also called as encephalon. Very good. This is going to be the frontal lobe of the brain, the parietal, temporal and the occipital. Yes. Remember, the forebrain, it is also called as prosencephalon. Forebrain, prosencephalon. Midbrain is called as mesencephalon. And the hindbrain is called as rhombencephalon. Hindbrain is called as rhombencephalon. Now, it is very important for us to know the locations. The prosencephalon, which is also called as the forebrain, it has this region which is called as telencephalon, and this one is going to be diencephalon. This is where the third ventricle is going to be located. Yes. And this region is going to be the mesencephalon, midbrain, and here we have rhombencephalon where the fourth ventricle is going to be, which includes metencephalon and the myelencephalon. Very good. So, question to you guys, metencephalon, where is it located? It is in between the diencephalon and myelencephalon. Yes. So, please remember this structure. In short, prosencephalon, remember the mnemonic TD. Yes, TD. T for telencephalon and D is for diencephalon. Yes. And rhombencephalon, R for M, which is going to be metencephalon and myelencephalon. Development of the brain is very important. We all know that it has developed from the neural tube right from the 3rd week of pregnancy. Yes, so if you can look at the beautiful image here, these are the stages of the brain's development. Yes, isn't it beautiful? Nice. The spinal cord in adult and neonates. In adults, remember, starts from C1 to L1. L1 ends at the lower border, whereas in neonates, remember, C1 to L3 right at the upper border. So these are the two important points which you are going to remember for the exam. Yes. Let's revise the meninges of the brain. Yes, look at this structure here. We are going to enlarge this part and we look at the layers. This layer is going to be called as what? The dura mater. The one round here is going to be called as the arachnoid, and this one is going to be called as the pia mater. Yes, it comes with the mnemonic DAP. Yes, I hope everybody knows this. DAP. The space between the dura and the arachnoid is called as what? Subdural space. Subdural space. Yes. And the space between the arachnoid and the pia mater is going to be called as subarachnoid space. Beautiful. Now, we have all studied about the subdural hemorrhage. Subdural hemorrhage looks like in which shape? Please comment your answers. Yes. And subarachnoid hemorrhage will lead to thunderclap headache. Yes, I hope you know this. Right. And then remember, CSF is found in the subarachnoid space. CSF is found between the subarachnoid space. Very important. Remember, CSF also CSF absorb and drains into the dural venous sign. Very, very important. CSF absorbs and drains into the dural venous sinus. Yes. Good. CSF absorbs and gets drained into the dural venous sinus. Dural venous sinus. It's very important to know this point. Pituitary gland, we all know from school that it is also called as the master gland. Yes, it is going to be pea-sized. Yes, look at the image here. This is where the pituitary gland is going to be pea-sized, weighs about 500 milligrams, and it is located in the sella turcica. Question to remember. Beautiful. Now, anterior pituitary. Look at this image here. This region right over here is called as the anterior pituitary, and this is going to be called as the posterior pituitary. Now, the anterior pituitary is also called as adenohypophysis. Adenohypophysis, and the posterior pituitary is called as neurohypophysis. Neurohypophysis. Yes, it is also very important to know the arterial supply of the pituitary gland. It is going to be superior and the inferior hypophyseal artery. These are going to be the superior and the inferior hypophyseal arteries of the internal carotid artery. Please remember this. Can also fetches that one important mark. The image which you are looking at is going to be the ventricles of the brain. Yes, you guessed it right. This is going to be the lateral view and this is going to be the anterior view. How many ventricles we have? We have 2 lateral ventricles, third ventricle and the fourth ventricle. Beautiful. Now, the lateral ventricles, where are they located? They are located at the cerebral hemispheres. Yes. Third ventricle is located at the diencephalon, and the fourth ventricle, as we have studied, is located in the rhombencephalon. All these are going to be important points to remember for the exam. Now let's try to identify the image and the important location. This region, this is going to be the lateral ventricle. So you can see these are going to be the lateral ventricle, and this region is called as what? The third ventricle. And just below we have the fourth ventricle. Yes, in between there is going to be an aqueduct which is called as the cerebral aqueduct. That's it. So 2 lateral ventricles, we have third ventricle and the fourth ventricle. Remember, in between the third and the fourth ventricle is going to be the cerebral aqueduct. Cerebral aqueduct. This is going to be very important to remember for the exam. Yes. CSF. It is formed by the choroid plexus from the blood. Yes, it's a very important point to remember. Beautiful. It is also important to know the course of the CSF. Yes, let's go. Now, we know that the CSF is going to be at the subarachnoid space. Yes, at the subarachnoid space right over here. Beautiful. Yes. Just now we studied about the 2 lateral ventricles, third ventricles and the fourth ventricles. Let's go. This region right over here is going to be the lateral ventricle. Yes. And this is going to be the third ventricle. Beautiful. Between the lateral ventricle and the third ventricle is going to be a very important foramen called as the foramen of Monro. Foramen of Monro. Yes. From the third ventricle, it descends down to the fourth ventricle, and there is going to be a very important aqueduct which is called as aqueduct of Sylvius. Aqueduct of Sylvius. Beautiful. Now from the fourth ventricle it further descends down to the cisterna magna. Cisterna magna. In between the fourth ventricle and the cisterna magna are going to be 2 more important foramens which is called as the foramen of Magande and foramen of Luschka. Foramen of Magande and foramen of Luschka are going to be very, very important. Yes. And as we know, it now goes toward the subarachnoid space. It is very important to also remember that the CSF absorbs and gets drained into the dural venous sinus. So this includes our important points to remember for the exam and the course of CSF as well. I hope it was very useful. Every hour you study brings you one step closer to your dreams, isn't it? Yes, it's not about the days, weeks or months. It's about the hour. Every hour you're spending, someone is watching it from the sky and definitely is going to give you the blessing. So please dedicate maximum hours towards your study and make sure that yes, and these hours are going to be productive and these hours are the one which is going to change your destiny. This is Dr. Auroraj, and I believe that yes, you're all going to change your destiny by this December. Wish you guys all the best and keep rocking and studying well. Thank you. Cheers.